What do you do if your child or you test positive for COVID-19? Let's have that discussion. My name is Dr. Noha Polack. I'm a pediatrician. I have been practicing pediatrics in Union City and Bayonne at Progressive Pediatrics since 1996. Message to our patients and to the community, we are available for you. We are here to help take care of you and your children during this COVID-19 surge. We would like your help. If you wouldn't mind, please using our patient portal to communicate with your providers for any non-urgent issues. At this moment, we cannot make appointments on the portal, but we're working on that diligently. We hope to have that ready soon. For right now, if you need us because your child is sick, please call the office in Union City or Bayonne. But if you are having a question that is not an urgent question, please use our patient portal to communicate. Let's get down to business. What is going on in Union City and Bayonne, New Jersey, in all of New Jersey, as a matter of fact, is that there's a pretty bad COVID surge. You already know that. Most of our patients, I would say 99% of the patients we've seen in the last 2 weeks with COVID have had mild to moderate symptoms. So even the smaller children, infants up until age 5 or 6, they're only having cough sometimes, but mostly runny nose, nasal congestion. Some are having fever for only 1 to 2 days. None of them have needed to go to the hospital for admission, thank goodness. The older teenagers sometimes do have more serious symptoms, and we are taking care of them well. They can have fever. They can also have cough, stuffy nose, body aches. So far, we haven't seen any loss of taste or smell with this latest COVID surge. So what do you do if you or your family members test positive? Number one, make sure that you notify everyone around you that you have COVID so that they can also get tested and isolate. Number two, please isolate yourself if you are an adult. In children, the isolation period, in my opinion, is still 10 days because they do not wear the mask well enough to control community transmission. So I know the CDC says 5 days and then you wear a mask for another 5 days. But when it comes to children, especially younger children, they need to be away from others that they can infect for 10 days after they test positive. When do you count day one? Day one is actually the day after that you do the test that was positive, or the day that you develop symptoms. That's when it is day one out of those 10 days. And so many questions coming into our office are regarding, do we need to do a second PCR test to confirm our at-home test? Right now, during the surge, you do not. You can believe your at-home test if it is positive for you or your child. Here in the office, we do have rapid tests, but for the most part, we're doing PCR tests because they are much more accurate than the rapid tests. If we see a child that absolutely needs a rapid test, we will do it, but it's a rapid antigen, not a rapid PCR test. Our PCR tests are going to LabCorp, and they are coming back in about 3 days or so, sometimes 2, sometimes 4, but the average is 3 days. So if you and your family members are all COVID positive, then you can be around each other in your home without a mask. But if it's only 1 or 2 of you that is COVID positive, then please try, if it's age appropriate, to isolate the person and to always wear a mask. So the sick person should wear a mask that is very well fitting, ideally an N95 or a KN95 if you have it available. And those people around them should also wear a mask if they are negative. If everyone is positive, then you don't need to mask and you don't need to isolate from each other, only from the community. So what should you have at home ahead of time in case your family does come down with COVID symptoms and tests positive? Number one is fever medications like Tylenol and or Motrin, some sort of rehydration solution like Pedialyte or Gatorade that can be helpful to decrease dehydration and help you feel better. You should have a thermometer to check the temperature. You should have a pulse ox machine that can check the oxygen level in your child or yourself. And you should have enough masks to last you a good 10 days at home. If you can get your hands on the N95 or KN95s, please do so, as well as some saline for the nose to help relieve nasal congestion. The saline spray or saline for a nebulizer, if you already have a nebulizer, is appropriate to have on hand. Another question we keep getting is, how long am I contagious for? The answer is 10 days. You're contagious for 10 days. Whether you have a mask on or not, you're still contagious. So please wear a mask as much as possible after your 5th day if you're an adult. But if you're a child, honestly, please keep the children home. So do you need to retest to go back into the community? Once it's been a full 10 days from your COVID test or from the first day of your symptoms, if it's been a full 10 days, then you do not need to retest to enter the community again. We do not recommend that you come in to get a negative test after your 10 days. When do you call us? You call us, of course, if you need advice about anything that I did not provide in this video. If a temperature is above 102 degrees Fahrenheit, or if the pulse ox, which is the oxygen level in the blood, is less than 93%, then you should call us right away. When do you go to the emergency department? And right now, the emergency departments are recommending us to get a test. Please don't do that. You might expose yourself and your children to COVID or other things like the flu. So you go to the ER if your child has a fever above 102 and we do not have an appointment to see you that day. Most of the time we will. As you know, we're open 7 days a week in Union City and 5 days a week in Bayonne. If your child has an uncontrollable cough, or if they're coughing so much that they cannot eat, sleep, or say a full sentence, that's a reason to go to the emergency room. I hope this video was helpful. We're here to take care of you. Call us if you need us for urgent issues this week. It's a pretty bad COVID surge, so we are not able to handle non-urgent issues at this moment. So we're going to concentrate on taking care of urgent issues. Non-urgent issues, please use the portal. We will reply to your portal messages. And as soon as this terrible time is over, we'll get right back to normal where we can answer your questions in a more timely manner. So if you need us, we're here to help you. Our phone number in Union City is 201-319-9800, and in Bayonne is 201-437-9600. Please be patient with us. We are stretched thin in terms of how many patients are requiring our attention at this moment, but we are certainly doing our best to take care of everyone. Please stay healthy and have a happy new year. Bye-bye.